Perfect. All right. Hi, everyone. I'm Thiv Paramsodhi, co-founder and CEO of Hera Fertility. And excited for today's class slash webinar, where we're going to talk about preconception, or the official title is We Hope to Be Pregnant Soon, AMA, and Ask Me Anything, what men and women need to know when trying to conceive. So we just kick things off. We'll wait a few minutes for a few more people. I know people are going to be joining through different social tools out there. And then we'll wait a few minutes, and afterwards we'll introduce the fine folks that we have here.
Sounds good.
All right. This is the first time I'm using all three, so bear with me. It looks like Instagram Live is working well, so that's always a place to be.
You're the tech maven.
I'm not. I'm actually not great at these things. It's a lot of trial and error.
It would take us a month to figure this out if we even could at all.
Exactly.
Amazing. Well, let's kick things off and introduce you guys, because I'm really excited about this. This is a collaboration. We've been working with Fertile for some time now and sharing notes, and I think both of us are at similar stages as a company, but have a similar vision of trying to help couples as early as possible in their journey in fertility and family building. So I have here Dr. Ron Feinberg, Dr. Katie Hagel. I'm sorry for mispronouncing your last name there. And Dory, where they're the team that make up Fertile. Maybe Dr. Feinberg, do you want to start and introduce yourself first?
Yeah, of course. Of course, the ladies should probably go first, but I'm happy to get started.
Should have done that.
So my name is Ron Feinberg. I'm a reproductive endocrinologist and have been so for more years than I'd care to admit. I work closely with Katie Haig and Dory Purse for more years than we want to count. But we've been a potent team, and past year and a half, we've been working hard to build a platform with focus on the preconception period of time, which is a very broad period of time. But I'll leave it at that and then let Katie and Dory chime in.
Katie, you want to go first?
Absolutely. So I am Katie Haig. I am a nurse practitioner, and like Dr. Feinberg said, we have worked together for, I'll say, well over 20 years. And I have primarily worked in the field of reproductive endocrinology, and I also have a board certification in family medicine, so family health. So that really has been my focus, and just helping individuals understand what their fertility potential is and how health changes can affect that.
And my name is Dory Purse. I am the Director of Client Services for Fertile. I do have 23 years of experience working at a reproductive endocrinologist clinic. For a good portion of those years, I was a coordinator, specifically for IVF, but I've also helped with inseminations and surgical procedures and things like that. My position there, and even my position here at Fertile, is basically just to hold your hand, to give you individualized care, to make you feel like you are our only priority.
Perfect. Thank you all. So let's get right into it, because we have a few questions here, and then I'll be monitoring the chat and any questions that are submitted through here. But we have a long list of other questions I want to get through as soon as possible. And so I'm going to kick things off with the first one. So for couples just starting to think about having a baby, what's the very first step you would recommend? And I would love to get an answer from each one of you guys. So if maybe Dory, do you want to start?
Sure. I think the most important thing is for the couple themselves to have chatted about this, to keep an open line of communication regarding what their goals are together. So when they do see a provider of any sort, they're both on the same page moving forward. So an open line of communication is always key between the couples and their goals. And then just being open to learning a lot about their bodies and a lot about the things that really aren't spoken about too much. You know, very rarely do you go to your primary care physician and hear about a semen analysis or even, ovarian reserve. So it is a lot of educating yourself, but we're there to provide that education for you.
Absolutely. And I think one of the things that we try to do, because we feel it is so important, is to be able to have conversations with people. And that's hugely important. So being able to find a trusted provider that you can connect with and really identify what your goals are is hugely important. So advocating for yourself, and sometimes that's hard if a provider doesn't bring it up to you directly, but being okay to start the conversation and say, hey, I've been thinking about having a baby in a year, 2 years, whatever that might be. And how could I improve my chances is a great way to get information on how you can optimize your health and put yourself in the right position for success.
I just want to add that very often the thoughts about building a family or having a baby is even before a couple exists as a couple. So frequently it could be a woman that's starting to plan ahead, a guy that's thinking, well, how would I do this? And in fact, we have seen a big uptick, and I'm sure the of you can attest to this, of men actually wanting to know what their fertility status is, possibly even before entering into a serious relationship. So this anticipation of potential challenges that could exist, I think, is running through both men and women's minds these days. On the female side, it's no secret that age is a major issue and major factor. Age is not a disease, but it is a factor. And there's more data coming out even for men that age is an issue. One of the biggest perspectives, I think, that the three of us came away from working in the fertility world is that it's a very reactive existence. People come with significant problem, a long period of time of attempting conception. And one of the most common things we all heard was, gosh, I wish I had known ... So I think that became the battle cry for us together at Fertile, and I'm sure you at Hera Fertility, to say, how can we head things off at the pass? How can we anticipate issues and problems? Because so many people now come to the fertility treatment world with things that honestly could have been anticipated and dealt with, or at least known about, months to years earlier. So that really became our big mission at Fertile, is how do we harness that information? How do we get that out to people? So here we are. I should point out, Dr. Haig, yes, who is a nurse practitioner, but worked very, very hard to earn that doctorate, did some really beautiful research looking at knowledge gaps and education gaps among young people. Correct me if I'm wrong, ages 18 to 25, roughly.
24, yeah.
Yeah, who weren't necessarily looking right now to get pregnant, but probably a large percentage would be later in their lives, and how little they understood or realized about the reproductive systems, what it took to conceive, what the statistics are, chances, what options are out there. And so that, coupled with the I wish I had known ... became a very potent, powerful formula to form Fertile. And then, ultimately collaborate with Viv and Hera Fertility. Viv, do you have that graphic that you could pull up or screen share of we posted it on social media, but the 5 phases of family building, which I think could create a new paradigm for how to approach this.
Yes, I do. Let me just pull it up here.
If you can, it's not terrible.
Yeah, and all of these are great answers, because a lot of times people are just, it's really good that you brought up that knowledge gap, because I think people just don't know what you don't know. And so it's really helpful to kind of walk them through and fill in those gaps. And so let me see if I can share this. And then I have a few other questions.
I'm not sure we answered the first question, but we dodged around a lot. I think the bottom line is reach out to professionals that know what they're talking about, and professionals that are willing to give you the time of day and the details to help you formulate a plan.
Exactly. And here's, do you guys see my screen?
Perfect.
Yeah. I really like this visual of the 5 phases of family building. Maybe Dr. Feinberg, do you want to just briefly talk through this visual?
Yeah, this actually came out of the blue when you and I were having lunch a week or 2 ago. It was like, okay, this is all preconception, because if you think about it, at neither stage has a baby been produced. So the early stage, and I'll do this really quickly, a twinkle in our eyes, we're thinking about things, could be at any phase of life, into, okay, a couple is actively working at trying to conceive. This could include same-sex female couples who maybe are going to clinics for artificial inseminations and things like that. Often people move to the not working so easily, or phase 3. They're trying on their own, or they're doing very low-tech treatments. And then a junction point, okay, now what? Well, we go to a fertility clinic, we're in higher tech treatments. Maybe things are working, great. If it works, you're not part of this anymore. But if it's not, and it's no secret that fertility care is not 95% successful, we all wish it would be, treatments aren't working, now what? So I think for the purposes of this brief webinar, we're focusing more on the early phases. But Fertile's there for people at any stage, because there's lots to talk about at every stage. And I think male testing, similar situation, certainly in the first 3 phases. It's very sad when we would see guys who could have been diagnosed with very severe sperm issues 2 or 3 or 5 years earlier, and went about on their merry way with a female partner trying to achieve pregnancy and weren't successful. So we're targeting these early phases, and the world is starting to come around and think about that a lot more. Gosh, we got to get off the first question.
There we go. All right. So the second one that I have here is, here we go. So how long should a couple try before they get concerned? And now we're getting into kind of the details here. Is the 1-year rule still the standard? So I'd love to hear, Katie, your take on this.
So I think that when somebody gets concerned is really person specific, and it has a lot to do with where they're at in life, specifically like their age, what their fertility has been in the past, and what their goals are. So I don't really like the 1-year rule, because I think that keeps people potentially from getting care that they need. And certainly if someone has tried, even after a few months, if they are concerned about their fertility, they could absolutely reach out to their provider, whether that's, our female patients reaching out to their OBGYN, or even going to a reproductive endocrinologist. They could have underlying issues like irregular cycles or something else that is making it hard for them to achieve a pregnancy, and they're going to need maybe a little bit more detailed care.
Perfect.
Let me add briefly, I think the 1-year rule is very, very outdated. It reflects a time when most people were in their 20s attempting conception. And probably, I think some people know this, but a lot of people don't. The chances of getting pregnant on a per month basis, even when you're in your 20s, is only about 20% at best. So By the time a couple is 35 or late 30s, chances drop to 5% per month. So I'm not a statistics guru, but if you just plug it into Gemini and say, all right, if I have a 5% chance each month, how likely am I to be pregnant after 6 months? And the answer is about 25% are pregnant, but a lot of those folks will have miscarriage. So the 1-year rule may not apply to a very high percentage of people and may not apply to anybody, frankly.
Mhm.
So we're trying to shift the paradigm to, no, if you're concerned, come talk.
Mhm.
Let's figure things out, because I wish I had known as the mantra. Well, we could have known about endometriosis or PCOS or irregular cycles or age issues, ovarian reserve, sperm issues. It's a different world now, and I think we got to change this old-fashioned model.
Well said. And so just to follow up on that, and I would love to get Dory's take on this, is a common question we hear as well is around the coordination of care. So this question is, how do you help couples coordinate between their OBGYN, fertility specialist, and lab work? And I think this one in particular is interesting because even to get started, it's an interesting journey. Some people go direct to a fertility clinic. It seems like choose your own adventure. So maybe Dory, I would love to get your take on how to best coordinate or kind of handle that process.
So you have to have a really good point person that has that ability to be able to communicate with all of those different facilities. You have to find someone that you're super comfortable with, that you're comfortable sharing all of your records and sharing everything with them. Here at Fertile, I would be that point person that would be communicating on behalf of that patient to all of the different providers, needing to get all of those records. We really need the full story. So it's getting the full story about that patient. It could be getting records from a primary care. It could be getting records from a urologist. It could be getting records from LabCorp or Quest or what have you. So basically that person is putting that whole story together for that ultimate provider to make all of those decisions. So it is a little bit of everything. But once you find that right fit or that right coordinator to get all of that information, that's when you can really start digging in and finding the diagnoses and really attacking, the issue of infertility if you're already at that point, to get those answers that you really need for you to reach your goal.
And I would just add one more thing, because it just doesn't stop there.
It does not.
Dory's constantly, because things are evolving. So I think to have a coordinator who's invested in, continuing the search as things go on and continuing to put those pieces together, because we don't always remember everything that first visit. We don't always remember things or realize that some things might be important to providers. So having a Dory coordinate or having someone that you can trust that really knows the questions to ask is hugely beneficial.
100%. All right. Thank you for that. And then the next one, an interesting one around time intercourse. So how important is timing intercourse around ovulation? Really walk us through what actually matters, what versus what's overhyped. I tried to summarize it because I think there's a lot of not noise, but a lot of tips or tricks that are around there, especially on social media around this in particular. So I don't know if Dr. Feinberg or anyone, whoever wants to start.
Yeah, so I like to say that our furry friends in the wild, in the animal world, including humans in past times, didn't really worry about timed intercourse. So that is a construct of what I'm not exactly sure, but that term has come about maybe in the last 30 or 40 years. And it's kind of silly if you think about it. So men with reasonably normal sperm counts, the sperm will survive in the female's reproductive tract for 7 or longer or more days. There's good evidence for that scientifically and whatnot. So the concept that you must time your intercourse with some hormone test or surge or change in mucus or whatever is a little bit silly. I should say also that there's probably no infertility in the animal kingdom in the wild, nor was there in humans until maybe the past 50 years, or there was very little infertility. I actually think, and I'll get on my soapbox about this, people would do testing of their LH surge, luteinizing hormone surge, and then try to time intercourse based on that. And I always used to say to folks, well, you missed out on a lot of fun because there's no real scientific basis to do that. Now, having said that, and part of what may have contributed to this is when we are offering actual fertility treatments to people, which could mean artificial inseminations, intrauterine inseminations, we only get 1 or 2 cracks at placing sperm in the uterus at the right time. So we want to try to optimize when we do that, which would be after an LH surge, or in the case of more advanced treatments, after an injection of a hormone called HCG. In my view, that's the only place where timed intercourse makes sense. In the wild or trying on one's own, somebody shouldn't have to time it. And in fact, having intercourse every day to every other day within a week of when ovulation is expected is probably sufficient. So I'll leave it at that because, I'm sure if others were on this webinar, it would start a rather heated discussion.
Heated debate. I love that. I did miss this other question from when we were talking about coordinating care that someone had brought up right now. So I wanted to just bring it back to there. So sorry about that. But how do you find those coordinators? Which I think is a really good question.
Yeah. At your GYN's office, it's kind of difficult because the care is not as personalized. I think it's looking for that personalized individual care. So doing a lot of research on your own, looking up practices, reading about the providers, reading about the staff. Unfortunately, one has to be their own advocate these days. Word of mouth is always great. It's always nice when you are able to speak with, friends or even family that maybe are going through the same thing, and you can, kind of share, not the specifics, but, I'm looking to become pregnant. Do you guys know of anybody? Have you had a great experience? Have you had a bad experience? You also want to know who to stay away from as well. So, it is difficult, but it's a lot of work on your end to find that right provider. And if you do meet with a provider and it's not the right fit, then move on to someone that you're going to be able to share these intimate details about you and your partner with and feel comfortable and know that they're looking out for the best interest of you and what your goals are. So it's basically being your own advocate, doing the research, finding, the profiles of the different providers that you feel like are going to fit your needs the best.
Yeah,
There's no list out there.
well, there's a lot of lists are lacking out there, but Dory is coordinator extraordinaire, and there's probably no one that quite matches her, but it's a big country out there. She can't talk to everybody, but
I can try.
One point about coordination that I think is really important, and I think both Hera and Fertile are on the same page with this, is for heterosexual couples that want to make a baby, starting the journey together is vital. So I know Thiv and I have had probably hours of conversation about this. Female partners often pushing their guys to get tested, and the guy has maybe a reasonably normal sperm count. Maybe it's a few little abnormalities, hard to say. But then the focus really has to shift back to the female, and really they're in it together. I don't think a normal semen analysis in a couple that's been trying for a while is a ticket to, oh, let's just keep trying for another 6 months or a year. I think if there's concern, in an ideal world, both the man and the woman would be evaluated at the same time. We certainly know in the fertility care world, it's extremely common to identify problems both in the male and the female. It's very unusual that there's just a single problem these days.
Yeah, exactly. Thank you for bringing that up as well. Now, I know we have like less than 5 minutes, so we might go a little over, and I definitely want to leave some time to kind of give share a little bit about Fertile and Hera at the end if anyone needs any help there. But just going to go through some of these last remaining questions. This one's a little bit, I think, could be on its own webinar, but we've heard this from many people. What's usually involved in that first appointment? So I think it's really around when that first time that you're maybe in front of a fertility, an REI, or maybe an OB talking about fertility. But what's usually involved in that first appointment, and what tests should you do beforehand? So I don't know if anyone wants to take a stab at it first, but we hear this often.
I nominate Katie to jump in on that one.
There's a lot in the first appointment, especially with a fertility specialist, and it can feel really overwhelming. I will tell you, a lot of clinics are going to either mail you or most of the time email you a package of information that's going to include, your own specific contact information, but then questions maybe about your own medical history, your surgical history, and maybe even detailed questions about your cycles or how long you've been trying. So that can be, you feel like, oh gosh, I got to fill out all this information, and then you go in for your visit. And I can just, speak from my own experiences having worked in an REI practice, but you're going in and you're meeting with multiple people at this point. So not just, the front staff, but also the clinician or physician that you're going to be seeing, and, potentially a coordinator. And at that point, they're going over your history. They should be going over what your goals are and, what your cycles have been like, how many children, or what you would like to see your family look like in the future, and kind of drill down to, why has this been a problem for you? I think that one thing that gets missed is the fact that infertility diagnoses aren't just useful in terms of, potential pregnancy, but also they really give a good marker to what your overall health is, and can really be helpful in identifying other issues that you may either currently have or might be at risk for in the future. So sometimes even that visit with a doctor can feel like a lot because you're going over a lot of information. And then oftentimes it's, okay, this is just step one. Now we need to come up with a plan. And a lot of times we're going over that plan. You might be meeting with a coordinator after you see the physician, and they're going to walk you through what that looks like, because that plan is usually timed out to where you are in your cycle if you're a female patient and you're looking at your own fertility. And then, of course, with our male clients, their workup is a little bit different, maybe a little bit easier to coordinate in some ways. So we'd also be talking about that as well. And any tests that you should do before, I don't really recommend, unless your GYN or, your OB thought that maybe they needed to order something for you. There's no reason that you should feel like you have to come with any specific testing done. If you have the option or opportunity to have a semen analysis through like a Hera, that would be fantastic that you have that background information, but don't feel like it's absolutely necessary to have blood work or any specific testing done. That should not hold you up from seeking care.
Yeah, in the old days, however you define that, there used to be a sequence of events where women or couples could see their OBGYN. The OBGYNs frequently were taking the time and effort to try to do a basic workup, and also to maybe even initiate certain types of treatment without getting into details there. I think more recently in practice, partly because we have a vast crisis of provider numbers in both in OBGYN and in REI throughout the country. Half of the counties in the United States don't have an OBGYN provider. And then with the internet and people's ability to get information on their own, there tends to be more of a push and a rush from the patient to go right to a fertility clinic. And I'm not saying that's necessarily bad, but the fertility clinics can't handle it either. Many have 6-month waits. And by the time you do get in the door to the time you're actually in treatment is sometimes several months or longer. So I think, again, there's a major gap in being able to take the time, do the evaluation, think through, oh, we need to touch on finances or emotions or logistics of what's involved. How do I do this with my 60-hour-a-week job? A lot of people seeking fertility care are in the professions, various professions, and are challenged in all sorts of ways in their lives. So in a perfect world, there would be many organizations like Fertile and HERA that could address those much earlier stages in the preconception timeframe and be able to prepare people. It's not necessarily putting fear in people's minds either. It's preparing them. People just want to know. And boy, a lot of deer in the headlights folks showing up at our fertility practice in Delaware, and I'm sure in every other practice worldwide, because there's so much that has to be talked about, so much that has to be addressed, and much of that could have been dealt with months or years earlier.
All right, so I know we're just over time, but I think I have the perfect question that we can end off on, and each one of you guys can give an answer here. So there we go. For someone watching right now who's been trying for over 6 months now, let's say, what's the one thing you would tell them to do this week? Maybe Dory, do you want to start?
I would tell them they could call Fertile.
Shameless plug. Yeah. And HERA.
And HERA, yeah. I mean, I think it's at that time, I don't want to say it's time to be alarmed, but it is time to start seeking some intervention, some professional intervention at that point. I mean, 6 months is a really good time to be trying on your own and, staying positive. But it can also become so discouraging. And that's where we don't want you to be. We want you to, still be positive about this outcome and moving forward. So once again, I'm going to say, stress looking for that right fit. For a provider, just to get started. And just like Katie said, once you do get started, this could turn into other health, concerns and wellness, concerns, but it can also give you the education you need to get yourself healthier to that point where you may not need as much assistance if you didn't seek that care right off the bat. So, I mean, I think it's fair to say you can try that 3 to 6 months on your own, but don't get to the point where it's so discouraging and heartbreaking that it's almost a painful process.
Yeah, I agree with Dory. I mean, I think that finding a provider or a healthcare provider that you can talk to and describe what's going on is hugely important at that time frame, but also, like Dory just mentioned, not getting stressed and don't lose hope. Just because 6 months of trying has gone on, that does not necessarily mean that you won't be successful in the next month or a few months. So the best thing is to not lose hope, but to have a conversation with someone and start, taking it seriously and saying, okay, I might need a little extra help here. Let's see what's going on.
Every situation is different. It's really hard to generalize. If a couple is 39 years old, you could argue maybe they shouldn't even have waited 6 months. If a couple is 29 years old, they have time, most likely, but we don't know for sure. We're trying to be good detectives. And we can't be good detectives without data and information. And so this is part of the challenge in our field is we tend to generalize. People assume that they're like everybody else. And we all have individual fingerprints and we all have individual reproductive potential. So I think if you look at it in that light, the completely personalized objective approach, and one other, I guess, shameless plug, we don't do IVF. We don't do actual procedures. Our revenue streams are not based on expensive treatments. We know all about these treatments. We know which ones work. We know more details than you could ever imagine. But we're not there to push anybody into anything that they're not ready for or able to do. And there is a lot of preparation that's needed on the financial side, on the emotional side, on the logistics side. And this is part of our mission to help people with that.
We got to leave off on that note. That's a great way to end it off. And so this went so well. So thank you all for listening and for the Fertile team to giving answers here. If anyone's interested to learn more, what's the best way to reach out to any of you guys?
So you can find us on fertile.com. There is and that's FYRTLE.com. There is a QR code where you can sign up and set up your own appointment, or you can reach me at 302-393-5765.
There's a direct line. It's surprising how many people prefer to just call. I think that just reflective of how this journey is so personal and they want to talk to someone. This is the first of 4 webinars that we're doing here at HERA with our partners to cover all the different topics around fertility, since it's National Infertility Awareness Week. So hope to see you guys on the other sessions. And thank you again for spending the time.
Thank you, Tim, for hosting.
Thanks. Take care.